MedSurg students, in this video, I'm going to teach you how to calculate critical care drips using dimensional analysis. What's great about dimensional analysis is that you don't need to memorize a formula. You simply just match the units, and I'm going to show you what I mean in just a minute. The first step in solving any dosage assessment problem is determining what you need to solve. And in nursing school and on NCLEX, you're going to know exactly what you need to solve without even reading the problem. So before I even read the problem, I look for the little line with the units behind it. And in this equation, I see that I need to determine the milliliters per hour of this problem. So that means I need to know how many milliliters per hour I need to set the pump. Now that I know that I'm looking for a flow rate, I will read the problem. So in this problem, the physician ordered an IV of dobutamine at 5 mics per kilogram per minute. The patient weighs 152 pounds, and the IV solution contains 500 milligrams of dobutamine and 250 mLs of D5W. How many mLs per hour should the nurse set the pump and round to a whole number? So the second step in dimensional analysis is that you're going to match the numerators. So this equation wants me to find milliliters per hour. So my X is milliliters per hour. And in dimensional analysis, what makes it so easy is we always match the numerator first. So I go back, because my numerator is milliliters, I go back into the equation and I look for how many milliliters I have. And it's 250 milliliters. And in that 250 milliliters, I have 500 milligrams. In step 3, I need to know if I need to convert the medication units. And as you can see here, the IV solution has 500 milligrams, yet the order is in micrograms. So I do need to convert. So the conversion is going to be 1 milligram divided by 1,000 micrograms. In this next step, I'm looking for the dose that is ordered. So it's 5 micrograms in 1 minute is what I need to add in my equation next. In the next step, I'm going to convert the time because I need to know how many milliliters per hour. In this problem, the dobutamine is prescribed in micrograms per minute. So I simply add 60 minutes in 1 hour to the equation to convert the time. In this step, we're going to convert the weight because the prescription is for 5 mics per kilogram per minute. Your patient weighs 152 pounds. So within the equation, we have to convert this. So the people that like to cross out are going to like this first equation the best, okay? So we are going to, at the end of the equation here, you see 152 pounds divided by 1 kilogram times 1 kilogram divided by 2.2 pounds. You can cross everything out. So students that like crossing out love this the best. Or at the end of the equation, you can simply do 152 pounds divided by 2.2 pounds because you know that's the conversion. Or at the beginning, you can convert that weight, and 152 pounds divided by 2.2 equals 69 kilograms. So you can just tag that on the end of your equation if you like. So I'm going to teach you how to keep it all in your calculator because it's really important you do it this way. A lot of students don't like dimensional analysis because they think they have to multiply all the numerators and then all the denominators. And this is the best way to make sure you're not making any rounding errors. So everybody, get out your calculators and I'm going to walk you through keeping it all in your calculator, okay? So we're going to start with 250 and divide by 500. Multiply by 1 and divide by 1,000. Then multiply by 5 and divide by 1. Then multiply by 60 and divide by 1. Then multiply by 152 and divide by 1. Then multiply by 1 divided by 2.2. Now, just be careful. Always use the ones because some people skip that step, and if you skip that step, you may make a mistake. Okay, so that's how to keep it all in your calculator. And as you can see here, the answer is 10.3636 milliliters per hour. But we need to round to a whole number. So the answer to this problem is 10 milliliters per hour. There you have it. The answer is 10 milliliters per hour. And the more you practice this, the better you'll become at using dimensional analysis to calculate critical care drips. ATI has a great module on critical care drips, and they also have a practice assessment on calculating critical care drips that I suggest you do. Also in your classroom, there are more critical care drip problems that I suggest you do, and you probably will be doing it in your lab anyway. So just reach out if you have any questions about calculating critical care drips.